Hello again, amazing moms to be. Welcome back to our series of pregnancy in Japan. If you're new here, we have already covered confirming your pregnancy and choosing the right hospital. So be sure to check those videos out. Today, we are talking about something super important, that is maternity benefits and financial support in Japan. Let's be honest, pregnancy and childbirth can be expensive. But Japan offers several financial support systems to help ease the load. So let's break it all down. Before we get into the benefits, let's talk about how much childbirth actually costs in Japan. On average, a childbirth can cost you around 4 lakh yen to 6 lakh yen, which can be around 2700 to 4000 USD. If you have a C-section or you need extra care, then it will cost even higher. The final cost depends on the hospital you choose, type of room, and whether you opt for special medical procedure. But here's the good news. Japan offers several benefits that can cover most of these expenses. The biggest support that you'll get is Shusan Ikuji Ichijiken, also known as maternity lump sum payment method. This is a one-time payment of around 4,20,000 yen to 5 lakh yen to help cover the cost. Now there are two ways to receive this. Number one is direct payment, which is also known as Byoin Chokusetsu Shiharai. In this method, the hospital directly deducts the amount from your bill. The second one, reimbursement system, or Atude Shinsei shite Oketoru, which is you pay first and then apply for a refund. Most hospitals use the direct payment system, so you won't have to pay the full amount upfront. Just make sure that your hospital accepts it, and also you need to fill some forms. Number third is Shusa Teyatekin, which is maternity allowance. If you are working and enrolled in an employee health insurance, which is also known as Shakai Hoken, you may also get a maternity allowance. This gives you 67% of your salary even on your maternity leave. This allowance is for women who take maternity leave and is paid for 6 weeks before and 8 weeks after birth. To apply for this, you'll need to fill out a form with your employer and your doctor. So if you're working, check with your HR department as soon as possible. Next comes the child allowance, or also known as Jido Teyate. Now, once your baby is born, Japan also gives child allowance. This is a monthly payment to help with childcare costs. So this is basically 15,000 per month for children under 3-year-old and 10,000 per month for children from 3 to 15 years old. To get this benefit, you need to apply at your city hall within 15 days after your child's birth. If you don't apply in time, you might lose out on payments, so don't forget this one. So how do you actually apply for these benefits? Here's a checklist. Number 1, maternity lump sum payment, which can be applied through your hospital or your health insurance provider. Second is maternity allowance, which can be applied through your employer if you are working. Child allowance, apply at your city hall after birth. Most hospitals and employers will give you forms, so don't be afraid to ask. But if you need help, then you can also bring a friend who can speak Japanese, or you can also use a translation app. Now that we have covered financial support, what about maternity and childcare leave? In our next video, we'll talk about your rights as a working mother, how long you can take off, and what protections are in place for pregnant women in Japan. So make sure you subscribe and hit the notification bell so you don't miss on our next video. If you have any questions or personal experiences in Japan, then you can tell me in the comments. Let's support each other on this journey and see you in the next video.